Howdy, folks, and welcome to the Speak Up podcast, another episode of the Speak Up podcast, your number one topical discussion podcast surrounding all things mental health. And I'm your host, Ashley. And in today's episode, it's the Meet the Experts series. And we've got Dr. Shoshana Bennett on the platform today, who hails all the way from California in the United States. She is an expert in her field with a specific focus on postpartum depression. She's an author. She's co-authored and authored several books, most notably the Dummies Guide to Postpartum Depression, I understand. So if you guys, any of you guys with bookworms out there, you'll probably know about the Dummies Guides, those yellow books there's a great big consortium of guides out there on a whole manner of things. So I was really surprised and actually quite elated that you'd published that. And various other titles, and I think the one's pregnant on Prozac as well. I know that you've published that. So she's a clinical psychologist, just to summarise, with a special interest in postpartum depression. She's helped many people over her years as a psychologist, and yeah, so we're going to be talking to her about her career, touching on her career in these questions, but also I've got some sort of pie in the sky questions to ask her as well. So without further ado, I'll jump straight into the questions. So how are you doing, Dr. Shoshana? You doing well?
Doing very well. Thank you, Ash, and thank you for inviting me.
Awesome, that's great. So what we'll do then is we'll jump straight into the questions. But the first one is can you tell me a little bit about yourself and why you decided to come on the podcast today?
I love educating, and your interest really was what was interesting to me. So you seemed like you were really open and wanted to educate, and I'm all about education. I'm all about prevention of mental health issues whenever possible, but certainly helping with treatment and recovery so that one is healthier and happier than ever. And I really like what you're doing here with your podcast. At this point in my career, I pick and choose very carefully, but yours was one that I was very interested in supporting.
Yeah. Well, I'm actually quite flattered that you said that. Actually, it's yeah, I really am. Where did you find our podcast? Just out of interest, did you come across it on like Spotify or was it LinkedIn or?
I believe it was LinkedIn. Honestly, I'm not sure. I was looking around, and
Yeah.
frankly, often podcasters come to me. In this
Oh,
case, I believe I came to you.
yeah,
So,
yeah. I was
yes,
quite.
you're allowed to be flattered.
Yeah, thank you. Yeah, appreciate that. Yeah, yeah. I was checking my forms, and it came through. That you filled out the form. I thought, wow, this is great. That you wanted to come on and share that interest and things. So that's really great. Um, so, sort of, second question is, what made you want to be a psychologist? What was the sort of lead up to that? The pre-story to that?
I never had any interest in becoming a psychologist. Here's what happened. I was a special education teacher, and eventually I was an instructor at community colleges in the San Francisco Bay Area, teaching future special education teachers. Became pregnant. We were very much looking forward to our first child.
Yeah,
Once I delivered, I plummeted. I dropped into a really horrifying mental health state. I was horribly depressed. I had very scary images flying through my mind, especially about harm coming to the baby. I had PTSD, post-traumatic stress disorder, from the birth itself, actually, from the labor and delivery. It made me flash back on things from childhood. I mean, I was a mess. And I remember thinking, if life's going to be like this, I don't want to be here anymore. Now that's coming from a very, a generally very happy person before
yeah,
this. I had never had any depression or severe anxiety like this in my past. I did not know what had hit me. So I'll condense what happened. I
yeah,
went through 2.5 years of really a terrifying state. Nobody knew how to help me. Frankly, I was afraid of being completely open with the kinds of things I was thinking. I thought I'd be put away in a an institution, never to be heard from again. I thought my baby would be taken away, even though I thought I was a horrible mom and I didn't deserve to be a mother. It was really awful. But then we got pregnant again when I started to recover. Right. I mean, that's what can happen with depression. When you're in it, you can't imagine being healthy again. And when you're well, you can't imagine ever being in that state of mind again. Mm. About a year into the second bout of postpartum depression, after our second child was born, because you're very high risk to do it again unless you have a plan of action. And I'm all about that strategy to help prevent it the next time around. Yeah. It was about a year into the second horrifying state, now with 2 children, that I saw a program on television, and this woman was describing many of the things that I had been feeling on and off for years. I was both furious at the mental health profession. If this is so common, if 1 in 7 of us go through something more severe than the normal baby blues, where was the help? Yeah. And I started reading everything I could get my hands on that had been translated into English, and realized that many countries, the UK included, it was far beyond where the United States was. So I was just surrounded by ignorance, a lot of judgment, a lot of criticism. So there, a fire in the belly, I'll call it, started to grow, and I knew I had to do something with this information. Yeah. Started running a support group. And remember, this is the 1980s. There was no internet. Yeah, no, so this was all word of mouth. Yeah. And that's really how a new career came about. I was not a psychologist. And so I could offer information, psychoeducation to the people coming to my living room in Northern California and every week. But eventually women started to say, can we talk about how I was raised as a child? And can we talk about this relationship and more about, so I realized I needed to be licensed as a psychologist, or I couldn't take them further. It would be practicing without a license, which is very unethical. And, so that's really what launched me. And I became, really, hospitals started to come to me, clinics, doulas, midwives, various types of clinicians would come to me and say, can you teach us more about this? Can you offer in-service trainings? Yeah. So there were very, very few of us doing it. I'd say 3 or 4 in the 1980s. So that became a passion, and I'm just as passionate about educating today as I was back then when it all started.
So it's evolved from this like personal problem to like a personal like mission for your career,
it is
your
life. That is absolutely true. I never thought I'd be doing this as my life's work. I was very happy teaching at the colleges and doing what I was doing. Yeah. And in there somewhere, I was asked by numerous publishers to write their books on the topic, became president of our international organization, founded a couple of organizations on my own. But it really has felt, it's been so satisfying. Because I had to, there had to be a meaning, there had to be a reason why I almost took my life on a couple of occasions, thinking my husband and children would be better off without me, and it gives me such purpose to help launch new families, new parents who are suffering, into their happy new life, and to help them avoid the suffering that my family and I needed to go through.
Yeah, I think it's amazing, to be honest. Personally, I think it's really a noble thing as well. Very rewarding to devote your life's work to that as well. Like I think it's a fantastic thing, really. And you mentioned as well, you touched on it. You was doing teaching before, wasn't you? Is that right?
Yes,
before
I
he
was
was.
teaching psychology, rehabilitation therapies, early childhood education,
Yeah,
special education, right, in that area
yeah,
to budding teachers, and also helping folks with varying disabilities who are entering as students into
yeah.
the colleges.
Yeah, that's amazing as well. So you already had that kind of like compassionate side as well already like there, but obviously through your own sort of like challenges, you've like taken it like to the next level really, in terms of like helping other people and stuff like that. It's gone from, you know, you already sort of had that I guess that caring and nurturing side within you, but then, you know, something happened and it kind of, you know, took you to the next level, I guess. Um, so my next question is, it's sort of related to care and stuff. What's your sort of stance on medication and things, from a sort of, I guess, from a professional point of view, but also from a sort of personal point of view of, are you an advocate of medication? I know it's quite controversial, and there's like big pharma and stuff like that, and there's the whole debate around, is medication worth it? Are they just making money off the back of mentally unwell people, or is it, you know, there's the whole debate about it. But I guess really I want to know, pick your brains and want to know what your stance was on it, really. Um,
That's a big one. We could do a whole podcast just on that topic.
yeah. Hmm.
Okay, so here's how I would answer that question in a nutshell, because we don't have hours.
No,
I'm not a lover of big pharma.
no,
However, I have seen medications save lives.
yeah,
I am not a pro or a con. I am very much in favor of an individual using whatever modalities, and sometimes there are a few together. I don't think the whole answer comes out of a bottle.
no,
I never have. I mean, the best doctors I work with will say, I'm ready to prescribe to you, to their patient, but first get a complete assessment.
yeah,
Because
yeah,
again, right? I mean, we have to talk about sleep and nutrition and exercise and emotional support and physical support. I mean, there are so many pieces to each person's puzzle,
yeah,
right? Their wellness plan. So whatever each individual needs to do to feel 100%, uh, um, I'm in favor of that.
yeah.
So I don't mean to skirt your question. There isn't
No,
a yes or a no.
I think that's a good
Um,
answer. Definitely, I think that's a really good answer. There isn't a, yeah, like you said, there isn't a yes or no, is there? You know,
I will, it's not, it can't be, there are
oh,
some advocates and sometimes they're quite fanatical about where they're coming from. This is the only way or
yeah,
never ever.
yeah,
I'm not there. I mean, there is not a one size fits all for anything.
I believe,
Is
yeah,
there, right? There are
yeah,
many different ways there are different ways to feed our children to help them sleep at night. I'm talking new parenthood here.
all right,
There are different ways to do. So I believe that the individual really needs to listen. It's very hard when you're struggling mental health wise. I remember that very, very well. There was no help offered to me except some terrible medication. Actually, it's not a terrible medication. It was terrible for me. It was
yeah,
completely inappropriate for me. But I think an individual really needs to tune in as much as humanly possible and say, is this something I'm willing to do? What makes sense for me? What am I willing to do? What works with my values?
yeah.
I mean, there's so many different factors, and we need to
Consider,
respect where, right, who we are, what's important to us, and practitioners need to listen to their patients to say, is this a proper modality for this person? Do
yeah.
they need extra support at home for this to even be feasible? Things like this. I don't know why I went off on that
That's all
tangent.
right. That's all
I
right.
forgot. What were you asking me? I don't
It
know.
was about your stance on medication, but you've answered it quite well in that aspect of there's no right or wrong. There's different variables.
Right.
I think for me personally, I mean, I won't go into too much detail about my personal ailments and things, but for me, I've been on a long journey of trying one medication, trying another medication not working, trying another, the different therapies not working, trying another, and I think for me, if the medication works, I'm willing to take the medication. Obviously, that's my own personal stance on it. I'm not trying to advocate for medication for other people.
Mm-hmm. Mm-hmm.
I think I think for me, medication has its place for those that are like severely mentally unwell, and if medication is the only thing that helps, then so be it. But you know, that's their choice to make, I guess. Like similar to what you said, really, it's you know, it's up to them. But
Right. Although medication for any type of mental health
yeah,
issue, to me, an opinion I can give you is
yeah,
that it's never enough. Medication is never enough. It
no,
might be the only modality, as in, um, what you're ingesting. But
yeah,
I
yeah,
always think therapy is important. Of course, I've got that bias as a clinical psychologist, but
yeah,
I'd say a good 75% of my clientele in the perinatal, pregnancy and postpartum, they
yeah,
are not on medication. But I'm working with a particular population, some of whom have never suffered before.
yeah,
As in my case, it was suddenly,
yeah,
we're at our most vulnerable during pregnancy and postpartum. If something's going to surface, it surfaces then. So my population, my main population,
yeah,
this is all brand new, and they're considered to be acute disorders, and they go
yeah,
away. When someone comes to me who's been suffering for a long time, medication has been helping them,
yeah.
I would never suggest they get off that medication.
No, no, no.
I mean, I don't give medical advice anyway. I'm a PhD, not an
Yeah,
MD,
yeah,
but some kind of at least coaching with a comprehensive wellness strategy
yeah.
is also important along with the medication.
They say that's the gold standard, don't they? Like, is it medication and therapy together? At least over here, anyway, on the NHS, they say that that's the gold standard. But
Right.
obviously, it takes some time to get to that point where you, at least for me, like the right type of medication, the right type of therapy, and stuff like that. But I completely agree with you on that. Definitely. The next one is what's the difference between postnatal and postpartum depression? I'm coming at this from a complete average Joe, so
Yes,
yeah,
yes. I'm so glad you asked. Yeah, we're coming from different parts of
yeah,
the globe. They're
yeah,
exactly the same. They are used interchangeably.
yeah.
Postnatal, postpartum, exactly the same. It's like nappies and diapers.
All right, yeah, yeah. And there's another term, perinatal, as well. Is that the same? Perinatal.
No, perinatal
Okay.
refers to the pregnancy as well as following delivery up to about a year. So perinatal covers that whole time.
Yeah.
Okay, so there's prenatal and pre-pregnancy, same thing, right?
Yeah.
There's postnatal, postpartum, same thing.
Yeah.
Perinatal covers pregnancy and the postpartum period up to
Oh,
about a year following delivery. Does that answer your
so
question?
yeah. So like both together, kind of in a way, kind of thing. The perinatal side of things. But yeah,
Peri covers both, correct?
yeah. Oh,
Yeah.
excellent. Okay, just to clear that up for some listeners that might not really understand what the
Yeah, the
difference is.
terminology can be confusing. It's like maternity blues, baby blues. There are so many different words for it,
Terminology
but
for it. Yeah,
same thing. Yeah.
yeah. And in your experience as well, and this is probably right up your street, this question, but how do we differentiate between the normal everyday stress as a parent uh, and like depression? When does it turn into something more like depression, and what can we do about it?
Oh, that's an excellent question. First of all, I do want to. I brought up baby blues, maternal blues. Let me just talk about that because that is a very normal reaction to
Yeah,
new parenthood. We'll talk about birth mom for a second.
yeah,
These are. And it is a way of answering your question as well. These are very mild symptoms, ups and downs. So symptoms should be mild and gone at about 2 weeks following delivery.
yeah,
Okay. If it keeps going, it's postpartum depression, even a mild one. But also the severity of the symptoms, it might happen immediately, like it did in my case.
yeah,
If the symptoms, and this is also answering your question as well,
yeah,
if the symptoms, no matter what they are, whether it's anxiety, bursts of anger, short-temperedness, inability to slow one's mind if it's spinning, getting in the way of sleep at nighttime, any insomnia, doom and gloom feeling, hopelessness. If those symptoms are severe enough to get in the way of a person's daily life or ability to sleep at night, they need intervention. That's over the line. Look, parenting is about the toughest job on the planet, right? I mean, it is the hardest job. I work with CEOs. I work with, very high powered, people and, a few executives at Apple, they're big, right? Huge stressful jobs. They can't wait to go back to work on Monday, because they've been taking care of the kids over the weekend.
Just to get away from
this is much harder. Right. So, certainly the stresses are huge. When you parent well, it's easy to be a parent, but when you do it well, it's tough. But again, one should have a perspective and hopefully some humor in there, like, we're going through a tough phase, or, I'm questioning my, this or that, and talking with people, but they should be allowed to be, they should be able to be reassured and know and have a perspective of, this isn't going to last. So if a parent or otherwise is thinking, this is forever, there isn't any hope here, I should never have done this. If they have that kind of a mentality, that's over the line. They need some help.
They need help it sounds like, I think, like we were talking last week when we had a video call about the when it becomes hopelessness and like there's no hope forward and there's no way out, then it becomes like is it going to turn into like suicidality and suicidal thoughts?
That's right. It's hopelessness. It's when a person is thinking the pain, no matter what kind of pain, emotional pain, physical, is going to be forever. That's what leads to the hopelessness and then the danger of suicide. Yes. So, I bring in humor in my work with clients as soon as possible. I was asked to write Postpartum Depression for Dummies, and thank you for bringing that up. Because it was a perfect fit, because, at the beginning, when someone contacts me, they're not laughing about anything. I mean, they're in a crisis and thinking, is this the rest of my life? I know what that feels like. I was there, and I was looking at a bunch of pills a couple of times in my life. Right? I mean, I know how low one can get, but as soon as they get the information and the education and understand what's going on, most importantly, understand that this is an acute illness, this is going to go away. At least the severe bout of the perinatal illness is going to, lighten and eventually disappear. Then they can giggle about it and go, there's such relief. Right. And then we can bring in a little bit of, then she can start to giggle. I'm saying she, by the way, but fathers can also experience a postnatal depression as well.
How does that sort of differ then? Obviously biologically it's different, but the father can maybe feel like he's like less of a man. Am I right in saying that, or is that?
There are biological reasons. I mean, not the reproductive hormones, of course. That's her. There are biological reasons. There are sociological reasons. There are physical reasons. There are sleep deprivation. I mean, a lot of fathers are taking care of their infants at night, and if they're sensitive to sleep deprivation, it can lower their serotonin, and they can become depressed as well. Certainly, yes, a lot of stressors on dads, especially if she is depressed. Their rate of postnatal depression shoots way up. Typically, it's about 1 in 10 dads have depression. But if the mom is depressed, the rate goes up between 24 and 50%. So the highest risk factor is if she's depressed. So that's why I make sure that the spouse is getting some good support as she is recovering. Because he's trying to
He's trying to balance
He's trying
the
to take care of her, right? Take care of the baby, pick up the slack about what's not being done, earn money for the I'm talking in a general way here, but that's often how it looks. And so as she starts to recover, he can go, here's what I've been holding on to all this time, and start to exhibit some illness himself. Yeah.
Yeah, that sounds, I mean, it sounds very contributory, like in terms of like, if the mum's ill, then I can understand the dad feeling frustrated from a male perspective anyway. I can understand that maybe he feels obviously an obligation to look after the child and the partner, the wife, or whatever it might be. So but those statistics you quoted as well, up to 50%, you said, didn't you, from 14?
Well, yes, if she's depressed and if he isn't getting proper help. I always want to add that, because it's not an automatic that if she's depressed, he could be, he's going to be depressed. It depends what kind of help. And it's not just any help, it's the proper help. I'm a big believer in this is a specialty. Now, when we're talking about perinatal illness, it's important that the person suffering and the close family members are getting the right kind of help. I mean, in my books, I write chapters for the family members, for the spouses. Here's what you do. Here's what you say. Here's what you don't do. Here's what you should never say. Here's how you take care of yourself in a very practical way. Because I know my husband certainly needed some help, and he didn't get it because there was no information when I was going through it. And of course, he suffered as well.
Yeah, and I can imagine as well, all those years ago, it was around the 80s, did you say, as well? The 80s?
It was the 80s, right? Our first child was born in 83, and the second child born in 87. Yes.
Completely different.
There was no help out there.
Yeah, no help at all. Do you think we've come a long way then in general?
We have. That's the great news. We have come so far since then. It warms my heart. I'm so excited. The same clinics that would at one point say, "Oh, Shoshana, we rarely see this problem here. We don't need your help." They've been coming and asking me to speak now for decades. So now they realize how common it is. They just didn't know what they were looking at, right? But we still have a long way to go. Yeah. We still have a lot of work to do. But now when somebody says postpartum, postnatal depression, they're not looked at cross-eyed. People have heard the terms and at least can relate. Maybe they're thinking of an actress who has come forward bravely and talked about her story, or maybe the doctor has actually taken an in-service training, because they're still not taught in medical school, at least not in the U.S. Really? It is not part of their curriculum. No. I'm not sure. It might be different in Britain. But no, OBs are not trained as part of their medical curriculum about mental health of their patients, believe it or not.
Yeah, that's interesting. I don't know the answer to that one about over here, but might be worth me asking. I'm probably of the belief that maybe they don't, but I don't want to jump the gun. I'll probably have to.
I don't know. My guess is that they're probably doing a better job than we are, but we're following in their footsteps. So hopefully we're not too far behind.
See, I thought you guys were all really ahead with everything, with technology and law enforcement and stuff like that. You got the
maybe in some areas, not in the perinatal area. No.
The next question is sort of about it's about COVID really, and obviously it's negatively impacted the world's mental health in general. Right. And this is another sort of pie in the sky question really. What would your advice or answer be to the crisis, or to those people that needed the help? What would you say?
Oh my. Well, happy to. I mean, we know that things are opening up now. People can actually get more help. I know I had been working, by phone and by internet for 12 years, even before
Oh,
COVID hit, frankly, exclusively. I hadn't seen anybody in person for a long time. I do so much traveling and training that I've been, working virtually for a long time. So it wasn't a huge deal for my clients, but that was an enormous transition. Those who are already in therapy, their therapists, it took a while before they got settled with and got comfortable and adjusted to having phone appointments, having virtual appointments. So the isolation was enormous during COVID, physically and emotionally, when no one was coming into anybody else's home. So the emotional support, the physical support, emotional support, I think those were the two of the most important factors that really exacerbated the mental health crisis during the pandemic.
Yeah, really, really difficult. And you mentioned as well that you've been doing like virtual therapies for like a long time before COVID. Do you see UK clients, or is it mainly just in the US?
I do.
Yeah.
I do. I literally see people from all over the world.
Yeah.
And take full advantage of the technology that back in the 80s we did not have. There was only the telephone and snail mail. I mean, isn't it? It's so hard to believe. I mean, rotary phones. There were no cell phones. So I'm dating myself here. Yeah, I'm going like this for the rotary phone.
The buzz and yeah.
Oh, and eventually we had the push button, right? But yes, but I take full advantage. The take home here is that there is really good help no matter where you live.
Yeah.
So a new parent can always find great help. Whether you're contacting me through drshosh.com, or you're going to Post-Partum Support International's website, or maybe you have a real specialist in your area that somebody has sent you to. Just make sure if you're suffering perinatally now, I'm talking in the specialty, make sure they know what they're doing in this specialty. It's not enough to talk to a nice person every week and just vent. I mean, you're calling in crisis. You need a practical strategy for recovering. You got a baby there, and so don't settle is really a message that I want to put out there. Don't settle just because somebody is paid for. I mean, sometimes you have to there can be some out of pocket. I know our insurance systems are very, very different, but make sure you get the proper help.
Yeah, there's some people that out there, ain't there, that like they've got the credentials and the my mind's completely gone, but I know what I want to say, but it's like
they have the alphabet soup after their name.
Yeah, exactly. But then they don't. Maybe they're not a specialist, like you said. They're not a specialist. Like really look at the credentials first before.
Exactly. Actually, just because somebody is a marriage and family therapist or a psychologist, it doesn't mean they can help you.
Yeah.
So you're absolutely right. They needed at least a 2-day training in this particular field. What organizations do they belong to that are specifically focused on parental mental health? What books, videos, what resources do they have right off the top of their heads that they can suggest? What type of therapy do they use? Because for instance, when a new mom or dad is suffering with perinatal depression, it is not appropriate to put them into long-term psychoanalysis. They need tools so they can put one foot in front of the other. You can see how excited I get when I talk about this, because I'm so busy for the last 37 years of doing this work. I've been undoing actual damage that very well-meaning health practitioners have been causing. Yeah. So again, that doesn't mean they're bad people. It just means they're not trained. They're not trained. So yes, I'm an advocate for finding the proper help, because in fact, in my field, I used to hear, as long as you get help, you'll be fine. I've changed that. Yeah. As long as you get proper help, you will recover.
Yeah, definitely. That's there's and there's a fine line, like you say. There's between, there's a fine line to be crossed, isn't it, between not so good, brilliant, excellent, or really, really bad. It's difficult and it's difficult for a patient to know what's good and what's bad if they're going on that journey of they've
Yes.
never had therapy before, they don't have anything to compare it to, they don't have any.
Absolutely, Ash, very well put. Also, when we're at our most vulnerable, it's really hard to be shopping around. I mean, depression depletes us. We
Yeah,
barely, I mean, I remember crossing from the living room to the kitchen felt overwhelming. And I'm typically a very active, task-oriented person.
yeah,
And I was feeling lazy. Of course, it wasn't laziness, it was depression. Also, I wasn't sleeping. I had a horrible insomnia. But so I couldn't even sleep at night when the baby was sleeping. By the way, big warning sign.
yeah,
If she can't sleep at night when her baby is sleeping, she needs help. There are other warning signs too. I'll be happy to go into if you want. But when we're that vulnerable and possibly also feeling hopeless, like nobody's going to understand,
yeah,
to be searching, for the right therapist, that can feel way too overwhelming. So maybe a family member can do that for you.
yeah,
In Postpartum Depression for Dummies and also Beyond the Blues, I list the questions, the screening questions that even your loved one can have right in front of them
yeah.
when they're finding the right therapist for you.
Thanks. Yeah, that's really good advice for listeners as well. And I'll sort of suggest them to check the books out and things, and read them. And I'll probably read them as well after this. Actually, I'll be your number one fan. What's been the most rewarding part of your career or your role to date, would you say?
Oh,
Or is that too big a?
the
Is that
the
yeah?
the most, I have to pick one.
Uh,
I'll answer that question really by saying, you know, there isn't like one incident or something. It's more
yeah,
knowing that there was a meaning, knowing that I I went through something life-threatening, two life-threatening times in my life, and it wasn't for nothing. There's a purpose, and I get to watch new parents turn things around with my guidance. And by the way, I don't take any credit for it. I know where this is coming from, but
yeah,
that's a whole other topic. And I see the joy and the hope and how they're launched into new parenthood happily the way we were not.
yeah,
I was not. It's the most satisfying. I can't think of a better job.
yeah.
Honestly, it is every day I get that satisfaction. So that's the best way I can answer your question.
Just to see them go full circle, isn't it? To from the beginning to the end, and see him come full circle as a person.
Yes, and actually, when we go through really tough stuff,
Yeah,
really major challenges. I'm going through a different one right now, by the way. If you're
mm,
interested, I'll be happy to share. I'm an open book. Um, and we use those challenges as horrific as they might seem in the moment,
yeah,
to not only recover but to thrive,
yeah,
and we can learn so much about who's really there for us.
yeah.
It might surprise us. Sometimes we
Absolutely.
think the people we think are going to be there for us, they're not, but people we hadn't even thought of are right there for us, right? We
Yeah,
learn about our own strength
mm,
and resilience, what we're really able to do, even though we have never given ourselves credit for that. Our relationships can be strengthened, and some relationships we let go. I mean, we learn so much if we choose to handle these crises in that way. So I know it sounds like, you know, Pollyanna stuff like, oh, you'll be better than ever, but you can be. You
No.
can be. My goal, if a client wants to be happier than she's ever or he's ever been before, that I love helping them get there.
Yeah.
They're happier, healthier, stronger, more grounded and solid than they've ever been before in their life before the crisis.
Yeah. Yeah. That's really quite poignant and quite hard hitting when you said, like, you learn so much when you go through these difficulties in your life, and that can be applied to anything, mental health or physical.
That's
or anything. It's
exactly right.
You learn so
Exactly right.
much. Some people, the abandonment can be quite traumatizing, but you do learn so much from it. And it's kind of like, I mean, I'm not religious, but it's like I want to say it's God's way of saying, right, I'm gonna put this in your way, and you're gonna learn a lesson from it.
Yeah, I don't think
Yeah.
it's like that. I think that's it. That is what it is, but that's again another.
Yeah.
But yes, absolutely. No matter what one's belief is,
Yeah.
these things can be put in our path for.
That's it. That's exactly what I wanted to say. Yeah, without the religious context. Yeah.
Mhm.
So in terms of, well, it's maybe slightly similar to the last question. What's your biggest sort of achievement or standout moment? It's kind of similar to the first one, but not.
Oh goodness, yes. I don't know another way to answer that, Ash. Because again, every day I get these sparkly moments. I am very, very grateful that I now have healthy, happy relationships with both of my children. I was so ill when they were young that I know my daughter developed an attachment disorder. I do this work not only for the parent suffering, but I watch out for the children as well.
Yeah.
And we worked hard on reconnecting and all of that. My son had difficulties in other ways. And so I guess this is a long-winded way of answering your question, that I am so grateful that we were able to put our family back together again, and become stronger, just like we were talking about, become stronger. And there was a lot of repair that needed to happen. So that certainly stands out as we can call it an achievement, or I don't know what we want to call that, but I'm so grateful that we were able to do that. Not all families can, depending on the damage that happened. The good news is, and actually I was asked to write another book, Children of the Depressed. This is for grown children who had at least one depressed parent growing up. And I was asked to write this book to help stop intergenerational depression, because often, even if it's not a genetic thing passed along, depressed behavior is taught, learned, right? So children, and then their children, and then their children, it can be repeated if we don't do things to make sure depression isn't passed along. So I had a lot of what my family went through in mind when I wrote this book.
That's amazing. Yeah, I mean, the whole idea of that is it's such a good good solution, a good thing as well, and a good book as well, because I mean, I don't know, but I've not heard of many books with that sort of spin on things, that sort of topic.
Well, you're right, and I mean, they're children of this and children of that, and there was no children of the depressed. I'm going. This is one of the most common mental health, right, challenges, and that's why I was asked to write it. And so now there is definitely a book, and the feedback I've been getting over the years. Because I put actual activities in there and things, if one is feeling up to it, they're again, questions to ask yourself, writing exercises, if you choose to. There's nobody has to go through these activities, but the feedback I've been getting has been profoundly positive.
Is this one you've just released, or is this one?
No, I didn't just release it. It's a few years now, but of course, just as relevant as it was when it was released. Yeah. So yeah, I suggest if your listeners find themselves or identify with this whole topic of having been raised with at least one depressed person, even if the person was never diagnosed, because often we know, that there was depression, or there's anxiety in a relative, but it doesn't mean they were ever formally diagnosed. It doesn't matter. It's what you know. What you know. Yeah.
Amazing. So it's another pie in the sky question. If you could change anything in the world, what would that be?
Oh my, your pie in the sky questions are really something. Oh, okay.
Maybe it's just
if I feel like I've been quite mean. Anything. Well, on this theme, I'll rein it in about a bit.
Yeah. Okay.
To mental health, actually physical health as well. In the whole healthcare industry, I believe people should have choices. We touched on this before.
Yeah.
We shouldn't just be told, this is what you have to do. Excuse me. Okay. Depending on the ability, the practitioner's knowledge of various modalities, there should be choices.
Yeah.
For instance, I'm going through a bout of breast cancer now. It's my second bout.
Yeah.
A third bout of cancer, but second of breast cancer. And depending on the practitioner, it's a very limited, what I was hearing is first you do these scans, and then you do surgery, and then there's radiation, and then there's chemotherapy, and then there's hormone. I mean, it was just, you must do it this way.
Yeah.
The truth is, there are many options out there.
Yeah.
Right? Yeah. Some are outside the country because the FDA doesn't like those. But bottom line is, whether it's a physical challenge, whether it's a mental health challenge, we have options. So my again, long-winded way of answering your question, but if I were to change anything, I would hope that all practitioners would be able to say to their patients, here's what I have to offer, but I also know there are other options. They don't have to be experts in all of them. That's impossible.
Yeah.
But at least be able to offer a smorgasbord, so that the patient can read, can research, can do whatever they want to do or not. But at least, you know what, that's right. I think choices are important rather than fear mongering, rather than, oh my goodness, and you better do this or else, so that's what I would change. It's compassionate listening, and it's also really understanding what might be best for the person sitting, in the patient's chair. Each practitioner tends to hit with their own hammer. Do you know what I mean? Like if there's an herbalist, that herbalist might think this is the only way. You must do herbs. An acupuncturist, somebody doing some energy psychology work like EMDR, for instance, or the oncologist, saying, no, you must do radiation or else, again, I don't mean to talk this much to answer your question, but options are important, and each individual really needs to to be able to choose, to pick and choose for him or herself, whether it's mental health or physical.
Yeah. Well, thanks for sharing that with us. That's quite a personal story of yours, but I appreciate you sharing that.
I'm glad, again, if I can offer anything from my own life that can enhance somebody else's, it gives me satisfaction. That there just might be a purpose why I'm going through this.
Yeah, there might be a bigger reason, a bigger reason for that. And we've come to the end, really. The last question: do you want? Is there anything that you'd like to add? Well, I just wanted to pick back up on the point you made about earlier. What you were talking about, the signs of postpartum depression when the mother can't sleep, when the baby's asleep, and you said you would talk a bit more about that if we have the time. Or
which would you like me to do first?
We can do the bit about the signs of the postpartum.
Okay, first, sure. Here are some of the signs to watch for in a new mom. If her self-esteem has dropped, if she is putting herself down, if she is saying things like, anybody can do this better than I can. Yeah. My husband picks up the baby and he can calm her down, but I can't do it. Or she says, my baby is rejecting my milk. Yeah. When, for instance, a baby pulls off the breast and looks around the room, that's a very normal behavior. But when she takes it personally, that is not normal for a new mom. So watch for statements like that when she's derogatory towards herself, self-criticism. Also, if she's short-tempered and snaps for seemingly no reason. I mean, can sleep deprivation cause that? Yes, but it can also be depression. Sometimes postpartum depression looks more like short-temperedness or anxiety. That's the other one. If her mind is spinning, if she's obsessing on one worry after another and reassurance does not calm her down, she's always yes-butting. Yes, but what if this? But what if she's what-ifing and she can't stop what-ifing? What if this happens? Oh no. If she really has a hard time relaxing or being reassured, there's one thing after, like another worry will take its place. She might relax about this one, but another, those are all warning signs. If her appetite drops, a new mom, especially if she's using her milk to feed, but even not, her appetite should be at least normal. And sometimes she needs even more food, more caloric intake if she's trying to produce milk. So if she does not seem hungry, if her appetite has dropped, if she's having scary thoughts, and by the way, scary thoughts can mean different things to different people. I mean, to one woman, it's, I think my husband is having an affair. To another mom with postpartum OCD, obsessive compulsive disorder, she can be having horrifying images of her baby being killed, right? That's not psychosis, by the way. So don't confuse that. She's in our reality. She's totally safe with the baby. But if she reports any of these things, again, she needs help right away. We don't want to be alarmist, go, oh my goodness. No, just make sure she talks with a specialist who can give her an assessment and tell her what it is and what it isn't. Yeah. Because I thought I was psychotic. I had OCD. So I was afraid of being left alone with the baby, but no, I was perfectly safe. So anyway, that's a whole other area, but those are some of the things. And certainly, yes, as we talked about, if she's unable to sleep when the baby sleeps at night, she needs help right away. Any insomnia at all, that's serious. And she needs some intervention. If it's a matter of just getting up a lot because the baby wakes her a lot, can that still cause depression, sleep deprivation? Yes, but that's not insomnia. So I'm concerned if the body won't allow sleep when they get the chance. So those are some of the things you're looking for.
Yeah. Yeah, thanks for that, and it'll be a good sort of checklist for listeners to kind of think, well, if I resonate with a few of those, then seek medical advice from the.
Absolutely, with somebody who is a perinatal specialist, hopefully.
Yeah, yeah, absolutely. Was there
Yes.
anything else that you wanted to add at all?
Oh, yes. I mean, one of my main messages, starting from way back in the 1980s, don't suffer in silence.
Yeah,
There is no shame that should be associated with any of these illnesses, these disorders. This is not a character flaw. It
no,
is not a personality weakness. I mean, these things can happen to the most loving, intelligent, wise, best parents ever.
yeah,
No shame should be associated with any of these illnesses, no more so than gestational diabetes or anything else.
yeah,
This can happen to the best of us. So the best, most loving thing you can do for your entire family is to get help, proper help, as fast as you can. That's when prognosis is best.
yeah. Well, thank you very much for that, and we'll sort of bring it to a close then. So, thank you very much, Dr. Shosh, for your contribution. It's been great recording with you and being on the episode with you. For all our listeners, that was Dr. Shoshana Bennett, who is a clinical psychologist from California with a special interest in postpartum depression. We've been talking at great length about her career, achievements, milestones, personal journey in terms of health struggles and things like that, and also a wider picture of sort of helping other people and what that means. So thank you very much. Really appreciate you coming on.
Thank you, Ash, very much.
Yeah. And you listeners, thanks for listening. I'm not sure what what we have in store for episode 9 yet, but we'll keep you posted. Please like, share, comment, and subscribe across all our channels. It's really important to get the message out there, and particularly on this topic as well, young mums and children and things, and to get them the best help possible, and sort of to educate people as well. I think that's really important. As Dr. Shosh said earlier, education is alongside laughter is the best medicine, I'd say. So thank you very much, you listeners, and I'll see you in the next episode.